Welcome to the AHRQ Data Tools website at datatools.ahrq.gov, brought to you by the Agency for Healthcare Research and Quality. In this video, you'll learn how to use the NHQDR data tools. Before we get started, please keep in mind the data in this video are for demonstration purposes and might not be up to date. NHQDR stands for the National Healthcare Quality and Disparities Report. The report is developed for Congress annually by AHRQ on behalf of the Secretary of Health and Human Services. The NHQDR data tools provide an easy way to search for and access the healthcare data included in the report. Let me start by telling you about the data sources included in the NHQDR. Healthcare data for the NHQDR include information from population surveys, healthcare facilities, administrative, and surveillance data sources. Using the NHQDR data tools, you can access a comprehensive collection of summarized healthcare data with over 700 measures from over 30 data sources. To access the NHQDR data tools, select the NHQDR card from the AHRQ Data Tools website homepage. After you select this card, you'll be taken to a landing page with 4 new cards. The first card is the National Card. It has data on national trends and benchmarks. In a minute, we will go through a demo of the tools available for the national data. The State Card allows you to compare a specific state's quality measures to the average of all other states for a benchmark of how each state is doing. Most of the functionality we'll learn about in the National Card can also apply to the state benchmark tools. The Data Query Card helps you to visualize state and national summarized data from over 30 data sources. If you want to learn more about this tool, please watch the Exploring the NHQDR Data Query Tool video, linked where you found this one. Last, the Special Emphasis Card contains tools that highlight priority topics for the Department of Health and Human Services. The dashboards and topics under this card are updated regularly. Now, let's check out the tools available under the National Card. When you select the National Card, the Trends Filter option will display data about overall healthcare quality trends in the United States. The All Topics option gives you access to performance measure data, such as comparisons to benchmarks calculated from top-performing states. The Race and Ethnicity and Income Levels options provide additional information on healthcare disparities. Let's start with the default Trends option to help visualize overall healthcare quality trends. You can change the displayed data using the subject area, topic, and trend filters. By default, the subject area and topic filters graph the counts of all national NHQDR measures. We can get more specific in our search by selecting a subject area. Let's select Priority Areas. Notice that the graph and data table disappear. In general, if the display goes blank on any of the data tools visuals, you'll need to adjust your filters. Let's do this by selecting the Topic filter, which is changed to reflect the priority areas that we selected in the Subject Area filter. To get more information on the Topic filter options, we can visit the Notes section below the data table. The Notes section describes the types of measures that are in each priority area. For instance, by expanding the Effective Treatment Priority Area note, we can read about the measures in the Effective Treatment Priority Area. Let's go ahead and change the Topic filter to Effective Treatment. The bar graph changes to display counts of effective treatment measures by improving, no change, and worsening trends. Under the graph, you'll find a data table containing effective treatment measures showing improvement. To learn more about the measures with worsening trends, change the trend filter to Worsening. The data table changes to display measures with worsening trend. You can download the data shown in the data table by clicking the Download Data button below the filters. When you open the file downloaded, you'll find the data displayed in the table along with supplemental information like the measure source. You can also assess how national measures are performing against the benchmark by selecting the All Topics option. After you select this option, a bar graph shows all the national NHQDR measures by performance achievement category, achieved, close, and far, which are defined in the section below the data table. By default, the data table shows national NHQDR measures that have achieved the benchmark. The race and ethnicity and income levels options are similar to the All Topics section. These options have additional bar graphs for the different categories of race and ethnicity or income levels. Let's explore the data some more by selecting health insurance under the subject area filter. The graph and data table disappear. Next, let's select private insurance under the topic filter. The bar graph changes to show 23 measures that have achieved the benchmark for individuals with private insurance. Let's use the bar graph to compare private insurance to uninsured by changing the topic filter to uninsured. The bar graph changes to show only 10 measures achieving the benchmark. This shows us that nationally, uninsured people as a group have achieved fewer benchmarks for quality measures than people with private insurance. Similar to the Trends dashboard, the bottom filter changes the data shown in the table. Let's change the benchmark filter to FAR. The data table changes to show 4 measures that are far from the benchmark for uninsured people. Please keep in mind, it's always important to consider the desired direction of the outcome when comparing measure estimates with the benchmark. For instance, in this example, lower rates are the preferred outcome for injury to neonates, but higher rates would be the preferred outcome for a measure of people with health insurance. This concludes your tour of the NHQDR data tools, and we thank you for taking the time to watch this video. Visit datatools.ahrq.gov to find more videos about the NHQDR AHRQ data tools and start exploring today.